Good morning, everybody. I'm News Center's Lee Nelson, live in the News Center Maine studio here, once again preparing for the Maine Center for Disease Control daily press briefing in Augusta, which is just about to begin. We are told that Governor Janet Mills will be joining CDC Director Dr. Nirav Shah today, so we will again be carrying this live. We'll take a look at what's happening in the room now. We have learned today already that Maine has its first COVID-19 fatality. It is an elderly man in Cumberland County. That is all we know right now. Again, as of yesterday, we had 155 cases. We expect that number to be higher today. And again, Governor Mills joining Dr. Shah in just a moment. A lot of the reporters who, when these briefings started, who were there in the briefing room are now calling in on the phone. And though some are still there appearing live and asking their questions live. And we've made the decision to carry these live every day, and we'll continue to do so as long as those updates warrant it, and obviously they do. Looks like there is a delay in things. Maybe things aren't starting up right now. Folks, you want to stay with this, or you want to go back to programming and start again in just a minute?
One moment.
Just waiting.
Today, the state of Maine joins the countless friends, families, neighborhoods, communities, states, and countries across the world in mourning the loss of an individual who had COVID-19. It's a sad day. Over the past several weeks, in the face of this unprecedented challenge, though, Maine people have stood together. We've faced these difficult times as we always have, with courage, compassion, and common sense, with generosity and patience, with our hearts open to one another. In this moment of grief for our state, we stand side by side still. Author Brené Brown said, her mother taught her never to look away from another person's pain. She said, never look down, never pretend not to hurt, not to see hurt. Look people in the eye even when their pain is overwhelming. And find people who can look you in the eye when pain overwhelms you. She said, we all need to know we're not alone, especially when we're hurting. So to the family grieving the loss of someone they loved, I know you are hurting. You're not alone. I don't know you personally, but I hope you hear me when I say we are family. And we stand by your side even as this pain is overwhelming. To the people of Maine, this news will no doubt worry many people who hear it. I can't say that we will not suffer more losses before this is over, but I know that we will get through it as Mainers, looking each other and the world in the eye, together, no matter the distance between us now. And we do need to maintain that distance. Please, please, stay away from other people. Stay home. Leave home only when absolutely necessary. Take walks, exercise. Buy basic things like groceries when you need to. Go to work if your job is essential and if you can't work remotely. But stay 6 feet away from other people and stay home as much as you possibly can. Please. Wash your hands frequently, use disinfectant, and stay home. The life you save may be your own, or it may be your child's. It may be your neighbors or your parents or grandparents, but it still will save a life. Things will get worse before they get better, but things will get better. They will get better as we all do what we have to do now, and that means staying home. We will get through this because we do stand together. We will get through this because we are Maine. On the mantle in my room, there's a quote from Emily Dickinson, which I think about every day. Hope, she said. Hope is the thing with feathers that perches in the soul, that sings the tune without the words, and never stops at all. Today we know grief. Today and every day we also know hope. I hope that God blesses every one of you and yours and keeps you safe. And God bless the state of Maine. Thank you. I want to turn it over to Dr. Shah for further remarks about today's update.
Thank you very much, Governor Mills. Good morning, everyone. My name is Nirav Shah, and I am the director of the State of Maine Center for Disease Control and Prevention. I'm going to share some information with everybody about the numbers that capture where we are in our response to this outbreak. But before I do, I'd like to pause for a moment and echo the governor's condolences to the friends and to the families of this individual who has passed. This is a reminder that the numbers that I'm about to share with you about cases and hospitalizations are all really people. They're friends, they are our neighbors, they're our parents, our spouses, our loved ones. In short, they are our community. And I ask that we remember that and keep that humanity top of mind every single time we think about this outbreak. As of this morning, the Maine CDC is recording 168 total cases of COVID-19 across the state. That represents an increase of 13 cases from yesterday. At present, there are 30 individuals who are hospitalized with COVID-19, and there are no new counties that have experienced cases. In addition, 24 individuals have recovered and have been released from isolation. All told, since the beginning of our activation, the Maine CDC has fielded now more than 3,600 consultation requests from healthcare workers and physicians across the state. I'd also like to provide an update regarding our distribution of protective equipment to healthcare workers, EMS personnel, and first-line responders across the state. Earlier this week, we received the second shipment from the Strategic National Stockpile. This shipment contains life-saving pieces of equipment for all healthcare workers and first responders. And right now, we are planning on preparing the distribution of that equipment in a fair and equitable manner across the state. That being said, what we have received is still not sufficient. And I continue to support Governor Mills' call to the federal government to release additional supplies and stocks of protective equipment from the Strategic National Stockpile. The infections, as we know, will continue to rise, both in number as well as geographic distribution. Having that protective equipment will be critical to ensuring the safety of our frontline workers so that they can continue to test patients who may be suspected of having COVID-19, as well as to continue to care for patients who do have COVID-19 disease. In addition, there are currently 86 available ventilators 86 available intensive care unit beds out of a total of about 164. There are also 247 available ventilators out of an approximate 308. Earlier in this week, I noted that the U.S. FDA has recently changed and liberalized the rules around what types of ventilators can be used for patients with COVID-19. For example, they authorize states like Maine to use ventilators that might normally be used in an operating room to care for patients who are in intensive care units and provide them that necessary air support. As soon as the US FDA made that change, we changed our system to be able to track the availability of those such ventilators. Just in the past day, hospitals have increased the number of those ventilators that they are reporting to us from 12 now to 58, an almost five-fold increase. We are continuing to work with hospital systems across the state to make sure they are reporting to us accurate, timely information about the availability of emergency medical supplies, be that intensive care unit beds, ventilators, or protective equipment, so that we can have a global sense of what's going on across our state and make sure that resources continue to be allocated fairly and equitably. I'd also like to provide an update on testing. In the past day and a half, Maine CDC has received additional reagents. These are the chemicals that help us conduct the test, the ingredients that we use in order to get the results that we need to patients. Because of this increased supply of those chemicals, the Maine CDC laboratory here in Augusta has a total capacity at this moment to provide tests for approximately 3,000 patients. However, we know that additional cases are coming on the horizon. And so we are continuing with the plans that we've talked about here to ensure that we have additional supports from commercial laboratories as well as via the acquisition of new pieces of equipment. Our goal is to have statewide the most robust testing architecture that we can. Part of that is done by our state laboratory here in Augusta. Part of it is done with the support of commercial laboratories that have been increasingly coming online. And part of it is done with our partnership and support of hospital-based laboratories to help them offer the test to individuals within their healthcare systems. I'd like to close by addressing a topic that has been one that I've been asked quite a bit, which is, when will this end? And unfortunately, in these situations, the virus sets its own timetable. But we will, as Governor Mills said, get through this because of, not despite of, but because of our collective efforts. The work that every single one of you is doing to introduce that physical distance, to try to introduce separation, to disrupt the natural flow of the virus, will help us change the course of how this disease impacts us in Maine. Never before, and perhaps never again, did I think that what I would ask for to foster community spirit is to ask people to stay home. But that is where we are right now. In times of stress and in times of emergency, our natural inclination is to come together. But right now, science tells us that the best thing that we can do is not come together, but be apart. But be physically apart, not socially apart. Now more than ever, the social bonds that connect us, that bind us together as families, neighborhoods, communities, and as a state are more important than they have ever been. So with that, I ask everyone to be strong, to be connected, and to be kind. Thank you very much, and I believe we'll take questions. In fact, we have a couple folks on the line. Maybe, Governor, if you don't mind, we'll start with them. I'd like to start with Patty White. Patty, your line is open.
Hi, thanks very much. Dr. Shaw, last week the case count in Maine shifted a little bit because some of the cases were from related to people from out of state. And I was curious how we're tracking those cases now, and are there actually more cases in Maine that are officially recorded because some of them are in people who are here, but they're from other states.
Great. So Patty's question is how we track cases and residents who are from out of state. And whether we are tracking any individuals, whether other states are tracking Maine people who may be in other states, and vice versa, whether we are tracking individuals who may be out-of-state residents but who are in Maine. And Patty, the answer to the question is that we can provide those numbers. We follow the rules that every other state does in terms of how we record cases. It's really mainly a bookkeeping exercise to make sure that cases are not double counted, and so that each case, no matter where that individual lives, is counted just once. And the way that states have decided to go about that is by the place of residence. We nevertheless keep track of those cases as well as those individuals, and we can provide that information. But there is an assumption that does underlie this question in some instances when people ask it, which is if you would only tell us the number of individuals who are from out of state who happen to be in Maine, then I might have a better picture of what's really going on in my community, and thus I might take different actions. And what I'd like to do is to speak to that directly, which is that we know that the virus is here in Maine. We know that it is circulating at a community level in at least 2 counties. We expect and anticipate in our planning for the fact that the virus will continue to spread across other parts of Maine. And so I urge everyone not to wait until you see cases in your county or community before you start taking preparatory action. Now is the time to start acting. Patty, to your question, we can get you the numbers themselves. Staying on the phone, I'd like to turn next to Lindsay Mills.
Hi, thank you very much. Can you hear me okay?
Yes, go ahead.
Okay. From the data that's available now, is there a formula or a way that the Maine CDC can now say how many more cases there likely are than what's been confirmed so far?
Great. So Lindsay's question is going back to the tip of the iceberg and whether we have an estimation of how big that iceberg is, recognizing that we're only seeing a tip or a part of it. And Lindsay, that's a good question. In any type of outbreak situation, whether it's COVID-19, influenza, norovirus, name your outbreak, what we know is that science and epidemiology is only able to give us a glimpse into what the total size of that iceberg is. There are models that are being developed by researchers across the country that take into account be counted or what might not be seen and allow us to get a better glimpse into what else is going on. None of those models has been fully vetted by the scientific community or published. The US CDC is working on a similar model. So right now, there isn't an estimation of, again, how big that iceberg is. We know it's there. I do want to emphasize, we know that in any outbreak, we are only seeing a tip. And so for that reason, my message to all Maine people is no matter how big that iceberg currently is right now, the time now is to start taking preparations, making sure that everyone in your family has a plan to stay safe, that you have medications on hand in case you need to be quarantined for a period. No matter how big that iceberg is, the time to start preparing is now. I'm going to turn to the room really quickly, and then we'll pick up some other ones on the phone. Michael.
I'm just looking for any clarification you have on when the man died, when he tested positive, whether he, I realize you may not be able to get into all this stuff, but whether he lived at Ocean View. Do you have any information also on how many of hospitalized people are in ICU beds or on ventilators?
Great. I'll take the questions in reverse order. Michael, your first question is, of the 30 hospitalized patients, how many are on ventilators or in the ICU? I don't have that with me right now today. We are beginning to start tracking that. We haven't decided how much of that will release on a day-to-day basis. Relative to the total number of hospital beds, the number of ICU beds is quite small, and so there we start to get into some privacy concerns. Our team is thinking about those questions right now. With respect to the gentleman who sadly passed, at this time we're not releasing any further information solely for privacy reasons. So, yep.
I have a question for the governor. Okay. So Portland has been in that stay-at-home advisory for over 24 hours now. Have you heard anything about how that's actually going?
I have not heard directly from John Jennings or anybody in the Portland city government. We've talked to John Jennings earlier this week. He advised what they were planning to do. We've tried to coordinate things somewhat. So,
Governor, Rhode Island has just announced that they're taking the measure of, you know what I'm talking about, pulling over the troopers, or troopers pulling over people with New York plates.
I saw that.
Yeah, you know, your thoughts about that, and you're concerned about, you know, New Yorkers and people from Massachusetts coming up to the state.
We're very much concerned with people feeling as if they can flee the virus by coming to Maine or other states where the population is less dense, or where we have not been designated a, quote, hotspot by FEMA or by the president or vice president. That would be a false motivation to come to any state. We are going to be putting up signage, and maybe we already have today, at the entrance to the turnpike, saying if you've come from an area that is that has COVID-19 as a hotspot, more or less, then you must quarantine yourself. Whether it's New York or Massachusetts or any other state, wherever you've come from, if you're coming from one of those hotspots, basically, you must quarantine yourself.
Is that a requirement? Is that an enforceable requirement?
Well, we'll see. We're not pulling people over. We're advising them. They have to stay put. Yes.
Shifting to unemployment, obviously the unemployment has spiked here and all over the country. Has there been any talks about expanding some of the hours for the Department of Labor office with all of the incoming calls? Right now people have reached out to us saying that the hours are only from 8 to noon and they're kind of restrictive on that. Any talks with the Department of Labor?
Yes, of course, every day, every hour almost. And two things. One, we were staffed with about 14 people to run the unemployment compensation office. Now we've borrowed from other departments and other departments within the Department of Labor to staff that up a little better. Secondly, we're waiting to see what Congress does today and when the President signs the bill that we understand is being debated right now in the House of Representatives. That will entail a lot greater effort on the part of all of the Department of Labor staff to beef up the 3 new kinds of claims that will be coming forward through the unemployment system.
I'd like to turn back to the phone for a moment. Amy Brown, your line is open. Amy Brown, if you're with us, please go ahead.
Can you hear me?
Go ahead.
Okay. Here in Winterport, in Waldo County, a worker from a really busy convenience store has tested positive for the coronavirus. The store reports that the last time he worked with, or she worked with, on March 18th, but the store waited until they got the positive test result on the 24th to do cleaning and to ask the other employees to stay home and self-quarantine. So wondering how concerned shoppers who stopped at that store should be, and also if businesses should be more proactive. If they have someone who has all the symptoms, who's home waiting for test results, should they be taking action as soon as they know that to try to clean and maybe quarantine their other staff? Thank you.
You know, we've strongly recommended that all retail establishments take specific precautions. Can't comment on one particular store, but you know, you got to assume it's everywhere. As Dr. Shah has said several times just this week, you've got to live your life as if you have it. Live your life as if it's here in your neighborhood, in your community, because it's just a matter of processing the test results and determining where it's confirmed. But it is everywhere. And when somebody decides to go to a store, make that decision thoughtfully, cautiously. Don't take your whole family. Don't go with a pile of friends. Don't pile in the SUV like you used to. Don't pile into a van to commute to work. in a crowded van of 5, 10, 15 people, stay away from other people, whether you're going to the store or going out for exercise or any other purpose, legitimate purpose. Stay away from other people. I can't comment on the particular store, but I've asked all the retailers, I've talked to the Retail Association and the managers and regional managers of all the big stores to do what I suggested the other day, that is limit the customer capacity to 100 if you're a big store over 5,000 square feet. Limit, making sure the carts are wiped down if you're a store with carts. Limiting access between shoppers and shopkeepers and staff. Some stores have actually put plastic shields up between the cashiers or the deli counter or the pharmacy and the customer, taking all these precautions. And I'm going to applaud some of them and urge the rest to keep doing what they're supposed to do. Limit the access, make sure things are wiped down, keep 6 feet distances between customers.
Back in the room. We'll go to who else has another question. Kevin, we'll go to the back.
Governor Mills, can you update us on what your thinking is as far as the statewide restrictions? I know we haven't gotten as far as some other states, but Portland, South Portland are making their own restrictions. Can you kind of update us on where your thoughts are as far as more statewide restrictions on travel, movement, things like that?
We took great care to issue a detailed executive order on Tuesday. We've issued other executive orders every day on specific issues, whether it relates to licensing of medical personnel or physical exams for kids coming into state care, all kinds of specific things we're addressing with specific orders. But the broader order of Tuesday stands. We did it, I think, pretty thoughtfully, carefully. Not a minute goes by, but what we don't think about doing something different or doing something more. It's hour to hour, day to day.
Oh, okay.
I've got a follow-on.
Go ahead.
Governor, it seems like there's been a little confusion about the executive order in terms of how it applied to places like Kittery Trading Post, which is a place that implemented a lot of your recommendations for large stores and also sells guns and other apparel. I'm just curious, are there ways for these places to stay open, like operating curbside, for instance, and are there other options? I guess is what I'm asking, for these places to stay open.
Only as respect to the executive order, which I think is self-explanatory. When people have called and towns have called, we've read them the part of the order that deals with essential businesses, as in good part defined by the Department of Homeland Security, and so-called non-essential businesses that may continue to operate as long as they do so without being public-facing, in all respects, avoiding any contact with public, vendors, customers, staff, spaced away from each other.
Could work, you think?
But I'm not going to comment on the nature of that particular business. I don't know how they operate, whether they have to have face-to-face contact for certain sales or not. But for the most part, certain big stores that were open last week are not open this week. Yes.
Governor Mills, over the past 3 days since we saw you last, can you talk about any discussions you've had with the Vice President and other governors?
Yeah, sure. I thought those discussions were off the record, but then I see the President issuing press releases about it. So we had an hour-and-a-half long talk yesterday. We've had, I think, 4 previous conference calls with the other governors and the President and the Vice President. The President was on the phone for 3 of the 5 conferences, including yesterday's. He did not talk specifically about the letter that was issued shortly after our conference call. So we didn't discuss the proposal to designate certain counties and regions as 1, 2, 3 categories. We did discuss uniformly the need for more PPE, the need for the President to employ the Defense Production Act authority that he has invoked, to require manufacturers, or at least strongly urge manufacturers, to begin manufacturing PPE, the reagents, and the things we all need. The governors are all in this together. There wasn't one governor who dissented from basically 5 issues we brought to his attention, including everything from invoking Title 32 to employ the National Guard to manufacturing more PPEs and reagents and the like, making sure that the unemployment offices are adequately staffed up, and making sure we have some discretion about how to spend new funds coming down the pike from the federal government.
Questions? Michael?
This one's for you, Dr. Shaw. What does the PPE burn rate look like so far for hospitals that have been affected by the virus in Maine? And as an example, how long do they have before they would run out of N95 masks at the current usage rate, or at least maybe a reasonable expected rate?
So Michael's question is about the utilization rate of PPE for hospitals across Maine. One of the principal reasons that we asked earlier this week that hospitals report to us what their existing PPE stocks are is so that we could start making those exact calculations. It's difficult for us to know what the burn rate is unless the hospitals are telling us on an occasional basis what they have so that we can do that math. There are, however, calculators, one of which is on the US CDC's website, that helps healthcare institutions calculate what their own utilization rate is, which of course we're looking at as we think about projections. But the fundamental piece of that equation is knowing where a hospital is. Just like with anything with data, in order to know where we're going to be going, we've got to know where we are right now, and having those numbers helps us know where we are right now.
So do you have any numbers on that?
Right now, I don't have those numbers with you today, but we're plugging those into the models that we're looking at to try to estimate, again, where we might need to go under different scenarios. And we can get those for you. And then the calculator that we are doing a lot of our reliance upon is one that is on the US CDC's website. It's available for chiefly state health departments, but it's not private. Anyone can take a look at it.
Do you have a conclusion right now? I mean, is your conclusion just that what you said at the outset, that we're not where we need to be?
Right now, with respect to PPE, we've got an umbrella and we're in a hurricane. Kevin?
Dr. Shaw, just a question about medical personnel. You talked yesterday about kind of putting out an appeal for folks to volunteer their services. What are the really core areas that we need additional medical personnel right now? And there was news, I guess, last night that Intermed is furloughing part of its staff. Can you just talk about those
Sure. So Kevin's question is about medical personnel and the core medical personnel, and particularly in light of some announcements by providers that they may themselves have to furlough staff. Let me say right at the top, right now, given where we've seen this outbreak go in other areas of the country, be that Washington, New York, California, Boston, every single medical provider is considered to be essential. That being said, what our planning is around right now are a few different fields. The first are individuals who can intake patients. So these are physicians like emergency room doctors, things of that nature, who are often the first point of contact with critically ill individuals. One of the reasons, even before that, focused on EMS personnel. So we think about the healthcare workforce in terms of a patient's journey. And for many patients, that journey starts with a call to the 911 dispatcher where they're met with by an EMS professional. When I talked earlier in the week about some of the distributions of PPE that we made, I stressed that much of that PPE went to people's neighbors who are working in those EMS forces. So EMS is one of our core constituencies. Second are the emergency room doctors who intake those patients. Thankfully, many patients who have COVID-19, not all of them require hospitalization. But for those who do, having a trained coterie of critical care staff, whether that be critical care nurses, anesthesiologists, respiratory therapists, respiratory technicians, that's the other sort of the third piece that we're highly focused on right now. That's in connection with the call to action that I made for individuals who are skilled in the areas of ventilators. So to summarize right now, the core groups that we're thinking about, among many, are EMS personnel, the professionals out there who are going to homes, then the intake personnel at the hospitals who are doing that triaging, and then the critical care staff who are, among other things, responsible for managing the ventilators.
People have emailed me and others on my staff about wanting to give their services. People who are retired healthcare providers, or people laid off, or people just visiting. And We have lifted some of the restrictions on licensing of out-of-state professionals and relicensing of people who have retired in recent years. And there's now a universal website that's available to coronavirus.maine.gov/Maine helps. Maine helps. coronavirus.maine.gov/Maine helps. That's for a lot of purposes. We've had a great influx of people wanting to give money, give food, donate services, help in other ways, and that's a great place to go to offer your services, especially if you have a healthcare background.
Perhaps, we've had 16 healthcare workers, I think, who have gotten COVID-19. Is that correct? Is that
I believe that's correct. We'll confirm those numbers, though.
And then, have you gotten any success in retirees maybe signing up? Retired doctors, nurses, and that. Are they signing up?
So Brad's question is about recently retired healthcare workers and bringing them back to be part of the COVID-19 response. We'll check to see what the response rate has been. I do know that since the governor and I spoke just a few days ago with everybody, where we made that initial call to action, the next day with respect to existing experts in ventilator management, anesthesiologists, critical care doctors, within one day, over 60 such physicians had gone to maineresponds.org to enlist and volunteer their services. I'm not sure if or how many of those individuals were retired or recently retired from practice. We can find out and certainly get those numbers for you. But again, I do reiterate and echo the governor's call. If you can help, whether that be through donations or providing medical services, we ask you to do so. As Governor Mills has said, as Governor Mills has said, that Wayne Gretzky has said, we want to be skating to where the puck is and where it's going to be. Sorry. And thus, we know that based on the models we've seen and the experience in other states, we know the situation is going to continue to get worse. We are continuing our planning and our response. Part of that is activating as many healthcare providers as possible. So, Michael.
For the governor, we just had a reporter call your brother. I don't want to instigate a family feud here, Peter, and he said that the Turnpike isn't putting up signage to the effect of a quarantine. That's just a Facebook post. Can you elaborate on what's going on there?
He emailed this morning and has been, I think he's in the process of doing some signage.
What do you expect? Just like the flashing signs or permanent signs? Do you know?
You asking me about signage? Sorry, not my area of expertise. They didn't teach that in law school or governor's training. I will add. Well, first, I was quoting Dr. Fauci, who was quoting Wayne Gretzky. But to be fair, double plagiarizing. But we've also issued an order yesterday, basically announcing we're closing a lot of state parks and state beaches, and this is really. This really hurts to do this because, you want people to be outside ordinarily, but there were more than 3,000 people just at Popham Beach on one afternoon last weekend, and they were crowding. It wasn't like the pictures of Fort Lauderdale and Miami, but we've got to avoid any and all crowding of people and places where they might crowd together like that. So we've taken that, I think, fairly drastic step to close these public beaches, these state-owned beaches in southern Maine and some other parks.
Dr. Shaw, based on the recoveries we've seen lately, a lot of them have been going up. Do you have any new information on that or any sort of trends that you've seen that has been helping the process?
So Joe's question is about the individuals who have recovered. And what information have we learned from those recoveries, not just necessarily in Maine, but perhaps nationwide or worldwide even. So our epidemiology team is, as sadly as our numbers increase, what that does allow us to do from a scientific perspective is to take a look at all of those cases, ill and recovered, and start looking for trends that we see. As sad as that may seem, we have to wait until there's a sufficient number. One of the tasks our epidemiology team is going to be working on this weekend is taking a look at the individuals who remain ill, individuals who may require intensive care, as well as those who have recovered. In general, nationwide, worldwide, individuals who have recovered, the recovery rate is quite robust. I say that recognizing that we are here on a sad day when an individual in Maine has passed. And so I fully recognize the grief that that entails. But nationwide, worldwide, recovery has been occurring. Recovery is possible. Those who have recovered have tended to be younger. They've tended to have fewer pre-existing health conditions. The onset of their illness, the degree of their severity of illness doesn't really seem to vary. But because this is a new virus, a virus that no one in the world had any immunity to, no one in the world had any exposure to, a lot of the scientific research worldwide on recovery and the factors that predict recovery is still being done right now. So, yep.
Dr. Shaw, obviously it's very early on in this virus, as you said. There have been some reports about potential long-term side effects from this. I know that you probably don't know exactly like what is going to come from this, but can you speak broadly on if a virus could, cause somebody to have long-term side effects?
So the question is on any potential long-term medical or clinical side effects of the virus. As you note, it is too early to have a full grasp of any of the exact or specific long-term side effects of having been infected with coronavirus. But what I will say to everyone out there is that not only is recovery possible, there have been individuals who have recovered and gotten themselves back up to 100%. There are, sadly, also case reports of individuals for whom recovery has looked different. As with any virus, especially with a virus where 10 to 15, up to 20% may require hospitalization, and a sizable percentage may require intensive care unit hospitalization. As with any virus of that sort, recovery will look different for different people. Some individuals may be able to get back to 100%. Others may, because of the nature of their pneumonia that they get, have some degree of lung scarring or permanent lung dysfunction. And as a result of that, their long-term activity may not be what it was before. Right now, what those numbers look like, and again, what factors predispose individuals to making full recoveries as opposed to different kind of recoveries, that's an area that the international scientific community is working on. Again, once papers are out there, I'm happy to talk about them. I'll try to post about them, especially if they change the course of our public health investigation. I'll do my best through various social media channels to keep folks apprised of what some of the research is. I think we've got last question. Yep.
Is the Maine CDC worried about a resurgence of this virus once these social distancing rules are lessened and people are allowed to go really back out together?
So the question is, what might happen when some of these social distancing, physical distancing requirements and requests are lifted? And are we concerned about a resurgence? The answer is that a resurgence of the nature that you describe is a risk. The goal underlying these physical distancing requirements is partly to squash out the virus, if possible, to disrupt that natural transmission from person to person, to introduce that 6 feet so that even if one person were to sneeze or cough, the virus can't travel far enough and infect another person. If we can do that in spades, then the virus may extinguish itself. However, the other goal of these physical distancing requirements is to do what we've talked about, to flatten the curve. That's a world in which cases continue to occur even as we lift the requirements. But we lift the requirements recognizing that there might be an increase, but also simultaneously recognizing that our system is prepared. Perhaps that preparation means we've got drug treatments. Perhaps it means that our supply of ventilators and healthcare personnel is where it needs to be. Perhaps it means in some world that a vaccine is even available. So both are goals. A spike is possible, but if that happens, our goal there is to ensure that our healthcare system is ready to provide care for each and every person who might get ill. So with that, thank you very much. Governor Mills, I'm sorry, ma'am.
Let me just add, among many other things, I've been talking with economists to find out if there are any good ideas about how to prepare to revive the economy. When will it hit rock bottom? When will the unemployment stats tend to turn around? And all they say is defeat the virus, flatten the curve, It's a public health issue that drives the economy as well. And if people think it can't happen here, if anybody thinks in Maine thinks it can't happen here, it is happening here, and it will continue to happen here. And we cannot let our health systems be overwhelmed with the intensive care that many patients are going to require. We cannot let that happen. And I beg you, stay safe, pay attention, don't take chances. Don't take chances. Let's keep Maine people as safe as possible and get through this together. Thank you.
Good afternoon again, everyone. I'm Lee Nelson at News Center Maine here. Governor Janet Mills and Dr. Nirav Shah, the director of the Maine CDC, just wrapping up this Friday's edition of their daily press briefing on the situation with the coronavirus in Maine and COVID-19. Maine has recorded its first fatality. Now, we learned an 80-year-old man in Cumberland County has passed away. And for privacy purposes, that's all the information they're going to release. They're not going to give a name or a specific location. And Governor Mills gave her sympathy to his family and also said, "We are family and we stand by your side. Please stay away from other people," she added. A couple of other things. There are 168 cases in Maine now. That's 13 more than reported yesterday. 30 people in the hospital, but 24 have recovered and have since been released from their quarantine. So perhaps some positive news there. A couple of other things. There's been a lot of questions about people coming into Maine from other states. Is that a good thing? Is that a bad thing? Governor Mills did say that signs are going up on the turnpike addressing people from Massachusetts, New York, and other places where there are a lot more cases. Not saying to go home, but just saying to quarantine yourself if indeed you do come into Maine. And the implication also being that you're really not protecting yourself anymore by moving away from one place to Maine, though it is less dense population-wise. We still have plenty of cases here. And they also did say, well, there are 168 confirmed cases. They are sure there are more. All right, so there's a lot more information to get through, and we certainly will bring you that this evening on our broadcasts and throughout the day. That's going to do it for now. We will join your next regularly scheduled program. Thanks for watching. Stay safe. Enjoy the sunshine. Again, we'll see you tonight at 5 o'clock.